Stand. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Just noticed, I never noticed that there was a flag in the back, so I could have like stood that direction. Everybody else just this
Yeah,
way.
everybody going every which way.
All right, how about a roll call?
Commissioner Hoffmaster, Commissioner Houts,
Yes.
Commissioner Leininger,
Here.
Commissioner Collins,
Here.
Commissioner Schaefer,
Here.
Commissioner Stoll.
Present.
Yep.
All right. Everybody's had a chance to check out the agenda. I'd entertain a motion to approve that.
I did move to approve the agenda. Presented.
Support it.
Okay, good. The motion with support. Any discussion on that? Hearing none, all those in favor say aye.
Aye.
Any opposed? All right, motion carries. How about the minutes from our September 25th meeting?
I guess I'll make a motion to approve from or September. Support.
Okay, we have motion with support. Any discussion? Hearing none, all those in favor say aye.
Aye.
Opposed? All right, motion carries. All right, so we're up to public comments. I don't see anybody here that would make a public comment, but we'll
Sir Don?
certainly invite
He will speak to the right.
any- anybody who would like to. Takers, okay? Health officer's report.
Good morning.
Morning.
So I wanted to brag a little bit first thing this morning. We received a Director's Award in local public health at the health conference a couple of weeks ago. Second place, we almost made first, not quite, but second place. And that was selected based on our submission on the OHSP grant work we've been doing, reducing traffic crashes involving Amish horse and buggy users. So we did also receive a $750 award prize for that. So
Thanks.
very proud of staff and especially of our health education department who made that happen.
Very good.
The agency also nominated for the 2025 Public Health Community Achievement Award, the Beacon Health System for their work that they're doing to improve the lives of residents within their service area. We were pleased that they were recognized with the award, and Kimberly Green Reeves from their Community Impact Office was able to attend the ceremony and receive the award. So it was very exciting to not only be receive an award ourselves, but have our nominee also receive. So obviously at this point, the federal shutdown is over. But I did try to provide an update with regards to WIC. The state of Michigan had chosen to put other funds that were available to them into making sure that WIC didn't cease or pause during the shutdown. And so we continued business as usual. I did give you some information there about the value of WIC benefits. The program policy and appeals reviewed that this morning, and it's on the agenda for full board approval later. We also, during the program policy and appeals committee, looked at the agency's fiscal control policy, which needed some updates. Those were suggested to PPA, and that has now been moved forward for the full board meeting today as well. We discussed a pass-through fee schedule policy. And just to slightly explain before we get there, it's also on the agenda later. in the food law in Michigan, we are required to collect a state fee that is identified within the law. And then, when we're collecting our license fee, and then we turn around and send that money to the state. So, what we were asking for was approval for a policy that allows us to update our fee schedule anytime the state makes a change to that fee, without having to bring it to the board. This is only with regards to a state pass-through fee. The local fee would not be impacted, changed, without board approval. We would always bring that to you. So this policy would just allow us to make updates to the fee policy with any state, directed fee that we are required to collect. Okay. All right, we also brought forward at PPA today a portal convenience fee update to that policy. And this makes the amount that we are charging more, I guess I'll just call it fair to the consumer, and provides a small portion of that fee, just a few cents, that the agency will cover, so that we are not overcharging any cents. We also looked at the Personnel Policy Committee manual today. The Personnel Policy Manual today. The committee reviewed the changes that were suggested back in October, and we brought that forward to PPA today, and that is also on the agenda for your adoption. We do have some positions. Our AAA RN Care Consultant position is open and posted. We have a health educator position that's posted. Josh Engelhardt, many of you know him, has accepted a position at Coleman Community Schools, darn it. And so he, it's actually his last day's Friday. So he's leaving us very shortly.
What's he doing at Colin?
You know,
He will be working with their online education and students that have specific needs.
and Josh's part is always working with kids. So, I mean, I think this really spoke to his heart, and anyway, big shoes to fill.
Yeah.
Chris is doing her best. She's gonna find that right. Finally, we have an immunization clinic clerk position, part-time, open in St. Joseph County. So those are currently posted. If you know anybody, send them my way. Just a couple of notes on public health concerns today. I did provide the most up-to-date arbovirus report. That's a state report. We didn't really see a lot of activity down here in the Tri-County area, but certainly there are cases of West Nile and other arbovirus diseases around Michigan. We certainly know that these viruses are present in our area, but we didn't necessarily have a case of West Nile that we know about yet, right? So with the nice cold weather that we had, perhaps we're done with that for this year.
So, yeah.
And we can,
If there's a benefit to that, right?
it depends on how much it warms them up. Yeah, we'll take that snow just for that reason. Seasonal immunizations, we are fully stocked with all those respiratory virus vaccines and want to encourage everyone to consider receiving those, especially this time of the year. So just want to remind everybody that those virus vaccines are available. And if you are interested, we'd be happy to make an appointment for you today. So our mobile unit on the road, we continue to provide WIC service opportunities in Waldron and Litchfield once monthly. And Hillsdale Hospital is out and about also with a mobile unit. They're going every Friday to a couple of different locations that go to Camden and to Waldron. And we actually sent out the first bill for their use of that unit this month. So it's nice to be able to partner with the hospital on that project. The work is completed here in Coldwater. Oh my gosh, this is kind of old, but you guys know which countertops are installed. The exterior upgrades are all done in Hillsdale as well. I don't know if you have had a chance to look. Oh, good. Yeah, they did a really nice job.
That's all by the bill. I don't get out there that often.
Well, when you do get out there, you just, you just kind of look
Looks
at,
very nice.
you look at 20 Pier Drive, and then you just pivot a little bit, and you look at the building next door, which was built about the same time, and you'll really be able to see how nice it looks. So that'll be your next project.
They were finishing up the eavesdrops, the downspouts today. I went out there.
Oh, yeah, yeah. No, it looks great. They did a great job. All right, nothing for Sturgis or Three Rivers, and just a reminder that my contract expires December 31st, and we'll bring a proposed contract to the Finance Committee at their December 1st meeting, so. And that's all I have for you today.
The countertops do look nice here, I think.
They do.
Not the teal tile is not the most modern look, but what are you gonna do, right?
For what our cost was on that. I thought they were gonna be gold plated.
Well, they are nice. I mean, they're
I said, but they should be gold.
they're granite, I believe, aren't they?
They are, those commercial contractors though,
Yeah.
Yeah. It's,
They
Um,
find ways to soak you a little bit.
With the passage of the state budget after our last meeting, we have to go ahead then and enter into that agreement with the dental hygienist for the
yes.
element or kindergarten oral health assessment.
We did, and she is out and going. So, and she's a contracted staff member, so we were closed on Tuesday for Veterans Day, because she was working. So schools were open, and as a contract employee, she gets to choose when it works for her, so, she was immediately,
I would advise, we're contracted, she's a subcontractor, she's not a contracted employee. That's an oxymoron, you can't be a contracted employee, you're an employee or you're a contractor.
okay, well, she's a contractor.
We can always count on you.
I must lose sleep at night.
Well, when he's out there doing chores, he's got to think about something, right?
Yeah, I guess. I didn't know by the sheriff's department.
No, I don't,
Mr. Schaefer.
they may wanna keep me.
Was there a summary on the traffic safety grant that we did? And if there
Mine
was,
Your end report,
can I get a copy of that, Chris? Did you do a summary evaluation of the traffic safety grant?
We submitted our final report to the state, which if you would like a copy of that, I'm happy to provide that. I do have an update on, in our HEP report. I can give you the numbers.
Oh, that'd be good. I'm pretty close to that situation.
Was there a submission that went in for that award? Or was that just they evaluated just based on what our activity here?
no, we submitted for that award.
I was wondering if that might be a good summary for it.
Yeah,
actually.
yeah.
So.
So
Whatever
we
we
can pull
submit.
some stuff together.
I was curious about the like flu vaccines, that kind of stuff, like just what insurances are like the health department is in network for.
I think you had a little list.
So we had, the health department came out to Thurston Woods last year and did vaccines. And then we got, some of our staff got notices that that they had a copay because it was out of network. And we have that in network is what we use. I think that would be fairly decent coverage,
We
but
did have a lot of issues, I know, last year. We had to get the farms. That's fine.
I'm not sure. So we have like a pharmacy that we work with, of course, that typically we get that vaccine from, and that's what we usually administer to residents. But I think this was primarily staff and maybe some of our independent living residents. that
Oh, the health department did not go here.
Last year they did.
Oh, they did, okay.
Yeah. And that's just curious if anything else. Yeah, I would think that we would be in network for the health department would be in network for.
Probably not Aetna. No. They're probably gonna look at a larger entity to maybe get a more discounted rate than maybe the health department would be.
That kind of thing, though, typically.
I really think it might be because the health department did it.
Oh,
You
Gotcha.
know what I mean? Like they should, like, it's going to cover it if it's given at some point.
I see what you're saying.
That might be the issue.
That could be.
Yeah, a lot of vaccines have to have the primary care physician, and we don't qualify as that,
I see.
so they won't take it. That's primarily if it's an HMO, not generally so much with the PPO. But we do run into that a lot.
I was just curious about
But
that.
a new issue, right? Clear, right?
All right. Anything else you want to add, Rebecca?
Yes, that's it.
All right, our our medical director's report, sorry.
Crazy this morning, I don't know why. My report is in your packet. I don't want to steal Chris's thunder, but, I would add that the opioid awareness day that we did at Hillsdale College in October was, I thought, fabulous. Great speakers and good attendance and very good interaction with the audience and speakers. Thought it was fabulous. And we're working on the winter provider newsletter. Sorry to say, because winter is not my favorite season, but I guess we have to move forward and skip the better weather and move on like everybody else. My education today, I decided to talk about hepatitis C. It's always on our little list of patients that we have in our communities, and it's actually my primary care doctor, and she was like, "I've never been tested for hepatitis C. You should be tested for hepatitis C." So that kind of sparked a conversation about the fact that they like to check at least one time in your life for hepatitis C. And if you have any risk factor, you will probably get tested a little more frequently. Because the hepatitis C treatment has gotten much better. So now that we can treat it, we look a little more diligent for it. So, and you know, hepatitis is just a term for inflammation of the liver. And the liver processes nutrients and filters our blood and fights lots of infections. And it can be damaged by things like heavy alcohol use, other toxins, some medications we take, and viruses like the hepatitis virus. So hepatitis C is caused by the hepatitis C virus. And the most common types we hear of in the US are A, B, and C. And lots of them have similar traits, similar symptoms. So yellowing of the skin and the eyes, fatigue, maybe abdominal pain, nausea and vomiting, and some of the hepatitis viruses are more serious than others. So hepatitis C ranks up there as one of the most serious because it can cause an acute phase and then a chronic phase. So you can go without any symptoms and not know that you have it, and then all of a sudden you find that you have hepatitis C and you're in that chronic phase, and you can have liver failure. It can cause death. It can cause liver cancer. So again, we're looking more diligently, and it's just a blood work test. So at your test to see if you have hepatitis C, and then you might need another test to see if it's active, if it's acute or chronic. The treatment are antivirals. So there are several new ones on the market, and it's usually spread by contact with blood of an infected person. So you can think about healthcare workers being at risk. You can think about drug users being at great risk. 6% of infants born to women with hepatitis C will also have hepatitis C. And there's also some sexual transmission documented, mostly men having sex with men. And then think about tattoo parlors and body piercings and why we do those inspections. And so all of those things, especially IV drug user for hepatitis. In 1992, we started screening for blood supplies, and so we're a little more diligent about looking at people who had blood transfusions before 1992, organ transplants before that time as well. So, and so you can prevent hepatitis C just by preventing all of those risk factors and being more diligent about those things. And treatment is actually very effective, and you can get treated with antivirals in about 8 to 12 weeks. Most people are proving to be done with their kind of one of those things that if we look for harder and find more and the treatment is good, that would be a wonderful thing. So there was an initiative in the state of Michigan, which back into that, but it was in 2021, the MDHHS combined with the pharmaceutical agent, and they looked at hepatitis C initiatives. So they started testing Medicaid patients for hepatitis C, and they started providing free treatment to those patients. Even if they were still chronically using IV drugs, they took inspectors that they started treating. And 61% of positive people in the timeframe from 2021 to 2024 were Medicaid patients that they found. And then they treated those patients and there was almost 97% success rate of resolving their hepatitis. So there was some issue, possibly that those the other three that didn't recover were still getting exposed to hepatitis C virus by some of their behaviors, but just showed the good effectiveness and another good initiative to take a look at a group of patients. So added hepatitis C in my blood work, so I don't think I've ever been tested, which was unusual. My family doctor was looking at it. I don't think we have any testing for hep C. So just another one of those, I think, things to look at because there's treatment now. So we can prevent a lot of significant illness, liver cancers, death. Another good public health thing to take a look at.
Okay. Question?
And hep A early in life, rare it's had again later in life, being transformed into B or C.
Yeah, some of them can. So concern also, like, say we want to treat for hep C, we have to look at the other hepatitises because the antiviral treatment for hep C could take hep B as they get more active, and there's a little bit of study on whether or not it could take hep A as they get more active. We do look at these things. Probably get tested for all of them once.
Well, I had A as a kid.
Ah,
I
okay.
was wondering, is it late? Well, where its ugly head.
Yeah, usually A does not, unless there's some other antiviral treatment that gets involved, and then it could. Yeah. Yeah.
Okay. Other questions? All right. Thank you.
Thank you.
All right. Personal health and disease prevention. Hi.
Good morning. I have some respiratory illness updates for you. Respiratory virus vaccination coverage in Michigan is low, 14.9% for influenza and 5.3% for COVID. RSV on adult 25 and up, and 41.5%. So that is good to see. As of October 11th, influenza-like activity remains minimal in Michigan, which is comparable to last year's levels. The state did send an updated guidance for respiratory virus outbreaks in long-term care facilities, and I did distribute that to all the homes in the Tri-County area. This has lots of information on what they should do if they do have an outbreak as far as reporting and reducing the cases. I have had a few COVID outbreaks reported since sending this out, so I think that's kind of off proof right now that they know how to do it and when to do it. CDC outlook, they do feel that this fall and winter's respiratory virus season is expected to be similar to last year's comparable levels of hospitalization for flu. Some other communicable disease updates and activity is still high in Michigan. I just added a little graph that I got from the Michigan Disease Surveillance System. And I am seeing an increase in pertussis cases as well recently. Measles, 28 confirmed cases statewide across 10 jurisdictions. 93% of those were either unvaccinated or lacking documentation of immunity. Muskegon County did report the second case of measles on October 7th. Highly pathogenic avian influenza is still present. It was detected in a backyard flock in Ottawa County. That was our 9th case since 2022. And we recently received notice that I just continue to emphasize the use of PPE and biosecurity measures to prevent the spread. Rabies, we've had 39 bats test positive this year. And then just some immunization updates. Like Becky said, we still have plenty of flu, COVID, and RSV vaccines available. We do have a limited supply of COVID and flu for those that do not have insurance, which we did not have that last year, so that is good news. Some recent vaccination events. We had a drive-through flu clinic at Burnside Center. I originally listed in my report 61 doses, but we actually gave 65. That was down a little. So I think a lot of them probably went to the pharmacy because they were a little late getting out there. We did hold some respiratory virus clinics at each location. They could get multiple respiratory virus vaccines at these. We had COVID, flu, RSV, pneumonia, and pertussis available. We had a few people take advantage of that, but we also gave a lot of other vaccines. So either way, it was a success. Becky kind of updated on the WIC program, but the agency does continue to exceed its assigned caseload, which is notable because many other counties have had a decrease in revolt. And I did include a little, it's very dark, but a screenshot of the caseload expenditure report that confirms those numbers. And then also mentioned the dental hygienist is back and going strong. And then as of her last fiscal year, she did complete 2001. So, I think that's all I have.
Okay. Any questions there? All right, well, thank you. Oh, L, Health Education and Promotion. Chris,
Good morning.
good morning.
So in your report, I did share with you just some of the highlights. We did manage to increase the media attention to raise awareness to the issue of safety around horses and buggies. We did distribute 500 buggy driver education books for the community to use in their schools. That book is targeting the young buggy driver. We created and distributed 400 buggy driver booklets, which are targeting the adult population and helping them to, it goes through road signs, road rules. We were even asked by the St. Joseph community to include how to navigate a roundabout. Apparently there's a roundabout in their area that they wanted some information on how to navigate in a roundabout. We distributed 2,000 RAC cards. Those were designed to increase and improve safety among the motoring community. We distributed 300 black reflective tape kits for them to use. We provided to them some suggestions after talking with the community on spaces where they could use that black reflective tape on their horse tack so that the horses would actually be visible at the corner if the buggy was not. We distributed 500 clip-on flashing reflectors. And then, of course, we facilitated the MDOT meeting with the bishops in St. Joe County about that project. And my understanding is that there were some design modifications made on that project based on the feedback from the bishops in the community. As Dr. Luparello mentioned, we did finish the elephant in the room. We did have approximately 90 attendees at that event, which I felt was very well attended, and we did have a lot of positive feedback. As Rebecca mentioned, Josh will be leaving us tomorrow, but we do have interviews scheduled for tomorrow and into next week for his replacement. The community health worker program has been busy. They held 38 appointments in September and 32 appointments in October. They continue to support individuals with applications to services through the Department of Human Services, referring them to community partners, assisting with Social Security applications for retirement and disability, homelessness, and insurance counseling. A couple items that are not in the report but have taken place since this was written. We have completed our marijuana grant submissions, and the application that we submitted for the firearm safety grant was not funded. And that is my report.
All right. Thank you. Questions? Anybody else?
What were you hoping to do with that firearm safety grant?
The firearm safety grant opportunity was to be utilized. Our plan was to distribute firearm safety, so cable locks, chamber flags, and then there was an educational component as well to work to try to promote hunter safety courses for youth, firearm safety courses for adults. We had support from the Veterans Affairs in all three counties, the sheriff's offices in all three counties, and the Great Start Collaboratives in all three counties provided us letters of support. Unfortunately, our grant was not selected for funding, but we will try again.
Commissioner Collins, you have a question?
Yeah, I believe I talked with you about it, the buggies using the green lights. We came up on one, it's been a month ago at least, that it was like 3 miles away and you could see the green that the state's using and well, I think everybody uses it now, county and towns and it really, the green one stuck out. They did have the red ones, so, but the green one, you could see it a long, long ways away and might be something to suggest the
Yeah, so,
community.
we've been reaching out already to new communities for 26. And we will continue to work our relationships that we've developed in 25. And so, we just continue to do the work and talk with community and try to continue to educate and encourage and support on both sides. So again, we encourage motorists to remember that they have more horsepower, they need to have more patience. Sometimes it can be difficult and challenging, but especially when it's darker earlier in the evening. So we just need to be mindful as we travel about those slow moving vehicles, whether it be a horse and buggy or agricultural equipment or people just walking alongside the road or biking.
Okay, any other questions? I always, this is a bit of a tangent here, but I always wondered why they chose green for like the road, like the plow trucks and all that.
Sticks out so much better.
I understand that. But what does green mean when you're driving down the road?
Go. Well, it catches your attention and you wonder what it is. I mean, because I was thinking it was a county truck.
Yeah.
And I was thinking, well, there's a county truck up here, must be something happened with a sign or something. And we started slowing down and it's like, it's a and it was, yeah, I don't know what it is.
It probably is because it stands out better, right? I mean, you got to guess that's the reason for it. So.
Mhm.
All right, environmental health, Joe.
Good morning.
Morning.
Just want to go over a little bit of things that we're dealing with in the EH section. I had the opportunity to go out to the inspection at Adams the other day, and just to kind of highlight some of the stuff that we're doing. I got lucky enough to get there when it was the little ones that were having lunch, where they had to get up on their tiptoes to even see. And I'm going through and I'm temping, and of course, being little kids, what do you do? Our staff gets the opportunity to educate at all levels, and I got the chance to talk to little kids about food safety and why I'm doing it and why it's important. I don't know if it registers or not, but it's just a good opportunity, and it was fun for me to be able to just kind of interact with them. So that kind of highlights some of the great things that we're doing in the food section. We also have the opportunity to help at these sporting events for concessions, because most of our schools are wrapped up now inspection wise, but the concession stands offer a lot of food to the public for volleyball, football, and fall, even cross country. So those opportunities to get in there, help the volunteer staff that aren't necessarily food safety trained all the way, to kind of give them some helpful tips just to make sure that the amount of people that are coming in are safe. And even some of our football stadiums are being used for district and regional final stuff. Even though our teams aren't there, it's still a lot of public coming in. So just really good opportunities to ensure that the public is safe. We'll be working here soon with Chris and her group about Thanksgiving food safety. We typically do that also for some Christmas stuff. So I'm looking forward to going out and doing some of those. I think they do some radio stuff typically. The other, I'm very proud of our staff. The other thing that we did is we had our private Type 3 Eagle accreditation review was completed just the other day, where they come down and they did an on-site review of all of our paperwork, and they went through everything, and with all the NPR indicators, we're all Mets on those, and that's a huge kudos to the general staff and Kyle and the amount of work that they put in to try to make sure we're meeting those NPRs and exceeding. Still a lot of work to do. That was the nice thing. The creditor was like, you're doing a good job, but there are places we can still get better, and we welcome that because we want to be one of the best programs in the state. So that was really exciting, and I just want to congratulate our staff on that. They're doing good work for the public.
Great.
So that's what I have, unless you have some other questions.
No. Questions, anybody? We'll move along. AAA. Hi, Laura.
Good morning. Good morning. I just Googled why green lights on plow trucks. And it's because, I'm curious too. The human eye can see the color green more clearly than other colors in low light conditions, like snow or fog. But then even when the sun's just coming up in the morning, it helps in bright sunlight as well.
It's easier to see.
It's
Right?
Easier to see.
I'm surprised with color blindness that they use either green or red.
Well, that is an excellent point too.
Well, I don't have time to Google that, but
Some chores.
It means go. You're driving, it means go.
Colorblind. You still see colors, you don't see 'em.
You don't see them correctly. All right, Laura, you put us off on a
back
tangent too.
to the task at hand. So I enclosed the fourth quarter Services to Victims of Elder Abuse programmatic report, which highlights our team's efforts throughout the year. And if you flip to the both counties page, which is 40, you will see we served 110 individuals last year, and that is more than we've ever served since the start of the grant in 2018. And, you know, we, in addition to directly serving victims and survivors of abuse, neglect, and exploitation, we've run these these interdisciplinary teams each month throughout the calendar year. So that's, those are our two main efforts with that grant. And I will say the community collaboration and the multiple types of victimizations, you'll see just even looking at the previous quarter, you know, they're just exploding. It's not just one way that the scammers are abusing somebody or exploiting somebody. It's also, you know, abuse, whether it's emotional or physical, from loved ones. There's just a lot of work to be done, and I'm so grateful for our team's dedication to really going the extra mile and looking at the whole picture of what a victim might be experiencing in their life. So they may just have a housing complexity at first, but then as discussion and sort of getting to know somebody grows, they unveil multiple traumas or other things to work on. So these cases are complex and very intense, and you know, we're again very proud, saddened, but keeping busy as this new year has 30 participants active this month. So it just hasn't been ceasing. We have begun planning for a symposium and some of the trainings that they've done over the past year. Law enforcement have a lot of new staff and officers and a lot of new people to train. So we'll be working with a few different state level and local level speakers to come in. And we're looking at different ways to hit different shifts as we've done in the past, because whether they're, you know, coming off a shift or going on to a shift, we want to be flexible and be able to accommodate a lot of different times of day, potentially different departments and their needs. So currently, with my update number 2, the budget update, you know, we're operating under a 3-month statement of grant award for state funds only. The federal government, as everyone knows, has just opened back up, but that's expected to take 6 to 8 weeks for the federal Administration for Community Living to issue those awards, called notices of awards, to the states. And then our state unit will have to churn the numbers and get us an award. So if you look, you know, through the calendar, it's not going to be until the new year. We're just glad that we can move forward. We did have to issue communication, as I noted in my update, to our providers, and have been continuously talking with them over the last 40 or so days about, you know, what is this impact going to have on your organizations and with the individuals you serve. And I'm pleased to report that all of them said they don't plan on any interruptions or pauses in service. That includes our transportation authority in both counties, the Commission on Aging offices, including our meals programs and our in-home services, as well as the legal services organization. So, you know, we're just holding steady, continuing to, you know, move forward. Last year, ended up very efficient. We won't have a ton of carryover, a few $1,000s here and there. We did expend our ARPA funds 100% in early 2025. And we've submitted our programmatic reports ahead of schedule, so that feels good. As Rebecca reported, our nurse care consultant position is open, and we are certainly not alone in this plight for credentialed staff. Health plan security are stealing a lot of folks. And so we're kind of suffering in the home and community-based arena. Number 5 is an exciting update. The My Caregiver Connection project was a year-long project with our Area Agencies on Aging Association, and they've launched a multifaceted media blitz and release of our statewide website, which is a neat tool for caregivers to seek information, kind of raise awareness to their own, maybe their stress level and how they're coping with their responsibilities, and then reach out to the local area agency on aging that serves their community. So we are super excited, and we'll hope you check that out. It just launched late last week, so we'll be working with and have been working with Chris's team to sort of revamp and revitalize our website to include this link and a teaser video, if you will, a 30-second video. So it's a really neat project, and I hope you'll be able to connect to it. The My Options project is going really well. Our team is now fully certified, and so we have 2 Medicare counselors in-house. They're helping and taking appointments because we're very close to being full in St. Joseph County with the counselors there. Branch County's Commission on Aging site with counselors is full, so we're receiving any individuals that seek counseling at their site here, as well as through the statewide call center. So they're very busy. And we're able to link up on phone or on video or in person, wherever the person or the couple or family want to meet. And just keeping up with all that body of work. Does anyone have any questions? No, I did include the annual implementation stand approval letter, so we're good to go there.
Good. Good. Questions? Anybody?
And as you said, Laura, disheartening to hear that, you know, last year was the busiest year since 2018, you know, in one aspect that an aspect of work that I wish our agency could work ourselves out of, meaning that we're not seeing elder victims of abuse. So,
Well, I would say that count is probably, I mean, it's gone undetected for so long, but the increasing numbers is probably a good sign that we're able to help more people, I would say.
Correct.
Yes, it of course is unfortunate that it affects that many people, but there's a lot more out there, honestly. But it's good that we're able to help people with that.
And some don't necessarily want the help either. You know, they just maybe want resources and then to move forward on their own. So it's the biggest silent crime across the country.
Yeah.
So
Appreciate it. Go ahead.
Or do you have a brochure yet? Here.
yes, of course. Yep.
Okay, other questions? All right, thanks, Laura.
You're welcome.
All right, we're up to financial reports. To our payments for September and October.
Yeah, so before you do have the payments for September and October. I would point out on page 46 at the top, second line is My Community Dental Centers. That's the $50,000 incentive for the dentist. And we talked about that a little bit last month, but that has been paid now, and I would be happy to answer any questions that you have.
I would move to approve the payments for the month of September and October 2025 as presented.
Okay, we have motion support to approve the payments. Any discussion? Further discussion? Hearing none, all those in favor say aye.
Aye.
Any opposed? All right, motion carries. All right, so our preliminary financials for September.
Yeah, so moving along, we are busy closing. My team has been working really hard to close out the year that ended September 30th. And we think that we are almost done. So these are very close to what will be the final version that goes to audit. We did end the year 8.88% under what we budgeted. And we did also go over in a number of programs, but we were able to backfill with local dollars that were unspent in other areas. So we ended the year in very good shape. I would be happy to answer any questions.
Any, just a quick guess as to increase, decrease in fund balance.
It should be an increase in the fund balance. We did meet maintenance of effort. We probably could have sent a little bit of money to MERS this past year, but I wasn't sure where it was gonna fall out. And so we did meet the fund balance. We didn't have to send it this year to meet fund or maintenance of effort, but it will increase the fund balance because we did spend.
I would move to approve the month-end September financial statement as presented.
Support. Okay, we have motion support to approve the financial statements. Any discussion? Hearing none, all those in favor say aye.
Aye.
Any opposed? All right, motion carries. All right, we're up to committee reports. Looks like finance did not meet. So that's easy. How about programs, policy, and appeals?
Program Policy and Appeal Committee meeting was held this morning. Yeah, everybody should have been passed out a copy of the minute that Teresa took at that meeting. There'll be many recommendations, items coming up underneath new business. And I would move to approve the Program Policy and Appeals Committee meeting minutes as presented.
Support. Okay, we have a motion with support. As I hold it, it still feels warm.
Hot off the press, hot off the press.
Is there any discussion on that? Hearing none, all those in favor say aye.
Aye.
Any opposed? All right, motion carries. Thank you. We have no unfinished business. We're up to new business, and it's the personnel policy annual updates.
So we'll review that this morning.
It was reviewed this morning in Program Policy and Appeal Committee meeting. There was one slight addition that we're recommending be added with the other changes. What page is that gonna be on?
It's on page 20 and page 23. It's actually two additions.
Yeah.
And the page number refers to the personal policy page number, not the packet.
So it'd be page 78 of the packet and page. So will it be 23 or will it be 24 when that's added in? Just clarification there that on the flexible spending account and the health savings account that we're not financial planners, we're not tax experts for our employees, that they need to seek their own legal professional guidance regarding their contribution and spending from those accounts. So just putting a disclaimer in there.
Otherwise, all the changes were what is reflected in the materials in your packet. So,
Something in there, other proposed changes. Entertain a motion to,
I would move to approve the updated personnel policy manual as projected with changes and the addition that was brought from the committee this morning.
support. Okay, we have a motion with support. Is there any discussion?
You okay with that, Brett?
Is now. Is now. Okay. All those in favor say aye.
Aye.
Opposed? All right, motion carries. Our fiscal control policy. Do you want to
This
talk
was,
about this?
yeah, this was just updating to remove the line, a credit card, yeah, the Walmart credit card, and it was removed from the policy language itself and then removed from the appendix. and there were some other slight changes to the account listed in appendix A because of that, but. And I would move to approve the fiscal control policy as presented.
Support. We have a motion with support to approve policy. Clearly went through committee. Is there any discussion on this? Hearing none, all those in favor say aye.
Aye.
Any opposed? All right, motion carries. And we have a environmental health pass-through fee schedule policy.
Again, which discussed this morning. This is just updating that policy that, so if the state assesses a fee that we have to collect in the environmental health department, that it does not have to come back to the board for approval. That fee will just be automatically adjusted in the fee schedule that we charge the applicant. And we'll work on the state to say we need to be paid. You know, we're paying the credit card for a process that, you know, we have to pay a credit card processing fee. They ought to pay us a processing fee to collect their money for them. But that's not in this, so.
All right, so do I want to make a motion to?
I would move to approve the fee, pass-through fee schedule as presented.
Support.
Okay, we have a motion with support. Any further discussion on that? Hearing none, all those in favor say aye.
Aye.
Any opposed? All right, motion carries. About our environmental health portal convenience fee policy.
And just some recalculations on that based on some experience use of that. Where we took that right through that. We will be paying the transaction fee anytime there's a transaction process on a credit or debit card, but just updating that fee schedule, and the residents don't have to pay that fee if they pay with a cash or a check, so. And I would move to approve it as presented.
I'll support that.
Okay, we have a motion with support to approve the convenience fee policy. Yeah. Are you gonna support it too?
Well,
He's
Rick
gonna
got it.
support
Been-
it.
Been notably silent over there, Commissioner House. Just like kicking back, just kicking back.
The budget system.
I need it too.
All right. Motion with support. Is there any discussion on that? And as Teresa mentioned in our meeting earlier, it's the transaction fee that's partially the issue there and causing a problem with calculating it correctly. So, hearing no further discussion, all those in favor say aye. Any opposed? All right, motion carries. Okay, so we're up to the West Michigan Health Insurance Pool resolution.
The final thing, and again, these were all discussed this morning, what resolution to the agency to join the Western Michigan Health Insurance Pool for 3 years, starting January 1st of 2026. This is for our health insurance. Also in that resolution, we are naming our health officer and our administrative assistant as our alternate, as our trustee, and our alternate trustee to the trustee board. I would move for approval.
Support. Okay, we have a motion with support to do the resolution. We did have some discussion about this in committee regarding who should be named trustee. I don't know if you want to share your thoughts on
But
this, but
I believe that it should be a member of the board of health that's named as trustee, not the health officer. Feel that as the elected officials, this is something that it's our responsibility to have that service and that interaction. So I made the motion, but I will not be supporting it. So
yeah, so we did discuss that a little bit. And I mean, the timing of it doesn't quite align. And I think that's the struggle maybe a little bit for making sure we just have something in place. But any other discussion or question about that anybody wants to ask? Okay. Hearing none, how about a roll call?
Commissioner House,
Yeah.
Commissioner Leininger,
no,
Commissioner Collins,
Yes.
Commissioner Schaefer,
Yes.
Commissioner Stoll.
Yes. Motion carries. All right, so we're up to our second public comment period. I don't see anybody here that wants to make a comment. Commissioner comments. Commissioner Collins, let's start with you. Okay, Commissioner Schaefer.
Veterans Day, you know, successfully passed over that, you know, veterans in our various communities. St. Joseph County did things a little differently this year. Maybe some of you did too. There's national push to recognize veterans for a whole week from the 4th through the 17th of November. Along with the encouragement is to light up various governmental buildings in green, recognizing veterans. Green, here we go. So, so our courthouse lighted every window in green, and it is really very beautiful. Along with many of the businesses in Centerville also participated their various signages and lit accordingly in green. So, anyway, if you didn't jump on that particular bandwagon this year, but encourage your counties next year to celebrate Veterans Day during the week and light various government buildings in green. So anyway, we were pretty proud of our work. It was really beautiful.
Yeah, it looked really nice, I thought. Good. Okay. Commissioner House.
CDC FOR did do their city office.
Did they?
Maybe the county and branch will incorporate into our budget this year to get green lights.
It was because you weren't here probably, actually.
But we will take care of it next year. Not have St. Joe County up.
Okay, the competition is fierce.
Go blue.
And I was going to mention that actually. I do love all the green discussion. It's great.
You know, they got to win something.
Commissioner Lender.
Yeah, and yes, we're talking about Veterans Day and appreciate those men who are living men and women who have served our country. Many of us will have that opportunity in our local communities to help commemorate those who have either gave their life in service or have died after their service by participating in the Wreaths Across America opportunities, and many of our communities here in the next month or so to laying wreaths on the graves of those brave men and women who have served. So take that opportunity if you got the chance.
Good. All right, I don't have anything to add. So our next meeting is December 11th, 2025. Do we need to talk about those committees or?
Well, so the finance committee is scheduled to meet on December 1st. I know these are not like the normal timeline, so we've struggled a little bit with PPA being able to get quorum. So just wanted to kind of bring it up. We know we have business for December 1st. And if our finance committee already knows that that's an issue, let us know now. So that we can maybe work on an alternative date. And then December 3rd, at this time, there is no business. But of course that could always change. So.
Sure. And I will definitely not be here on that for the 3rd. So if there is something that comes up that.
Yeah, and I won't be here on the 21st for sure. I've got a training at that day that I've got to be at of January.
Oh, okay.
I can always go in for 10th, 3rd, but I'd be here on the 1st and already done the job.
Fantastic. I do not know what Commissioner Hoffmaster's schedule looks like.
And I will be here on the 1st.
Okay. So that we've got, just
Good.
review, so.
I got such a busy schedule, but
Yeah, I got a
Yeah.
Jump for those green lights.
Yeah,
Yeah.
I got the green light. No.
You get here safely if you get the green light.
That's right. All right.
In January, I have to be in Lansing.
On the 1st.
January. You already looked that far ahead. Whoa.
That surprised you.
You know what you're doing in 5 minutes.
Life of a retiree.
I won't remember.
You probably forgot it, but it's
All right, I would entertain a motion to adjourn.
so moved.
All right, motion support. All those in favor say aye.
Right.
Opposed. All right, we are. Thanks, everybody.
I know somebody could say that that's elderfish, but I didn't like that.
Yeah.
I wouldn't remember it, but you did it.
We have a tape, right, Bill?
Yep.
Remember I-
Can't remember shit.
I don't remember where I parked in my spot.
That does happen to me sometimes too, like I'll park at Menards or whatever. I walk in. It's like, where did I park?
15-minute park expired.
All of you or?
If you don't, our plan.